Welcome, everyone. Thank you for joining today's webinar, Making Humanitarian Response Age and Disability Inclusive, the Minimum Standards. This is the first in a series of 6 webinars on age and disability inclusion in humanitarian action. DisasterReady.org is powered by Cornerstone On-Demand Learning Software. This is a free, easy-to-use online training resource that provides e-learning courses created to help prepare a growing community of more than 60,000 humanitarian aid workers for the challenges and demands they face in the field. The goal of DisasterReady.org is simple: to increase the preparedness and effectiveness of humanitarian aid workers around the world by providing accessible, affordable, high-quality training. Designed by experts in staff development and humanitarian action, DisasterReady.org is the result of a collaborative nonprofit effort between the Cornerstone On-Demand Foundation and leading aid agencies in the sector. Today's moderator is Frances Stevenson. Frances is the head of the humanitarian team at HelpAge International. She has specialized in international humanitarian policy and management with 18 years experience with international agencies, managing programs in South Asia, Africa, and Eastern Europe. Frances was also a research fellow in the Humanitarian Policy Group at the Overseas Development Institute, where she led the Humanitarian Practice Network, and has worked as an independent consultant in humanitarian strategy and management. Frances?
Thank you, Tiffany. As you say, I've been working in the humanitarian system for about 20 years now, and during that time we've seen a lot of important changes in the way that humanitarian agencies approach their work. And one of those changes has been the recognition that passion and commitment to the humanitarian imperative is crucial, but alone it's not enough. We also need standards to guide the kind of assistance we offer and how it should be provided. And everybody's familiar with the SPHERE project, which was the first comprehensive attempt to define what an individual needs in a situation in terms of food, water, shelter, healthcare, etc. And it's still the most widely known and internationally recognized set of minimum standards for humanitarian response. And the latest edition of the SPHERE Handbook recognizes explicitly that age and disability are cross-cutting issues that must be addressed in all sectors of humanitarian action. So the ADCAP minimum standards take that recognition one step further by defining the standards that must be achieved to ensure that older people and people with disabilities are included in humanitarian response. And as humanitarians, we all want to help people to survive conflicts and disasters with dignity. And most humanitarians now accept that a one-size-fits-all approach is not an appropriate or effective way to do it. And people of different ages and different kinds of ability need assistance that is accessible to them and that meets their specific needs. So the ADCAP minimum standards have a crucial role to play, enabling humanitarian agencies to provide this kind of assistance. And I'd like to introduce you now to our 2 speakers today. Sarah Collinson is a research associate in the Humanitarian Policy Group at the Overseas Development Institute. She's had senior research and policy positions at Chatham House, ActionAid, and the Humanitarian Policy Group, and a number of other research centres, and she's taught at the Refugee Studies Centre in Oxford. Sarah's work spans a range of humanitarian policy issues. Her latest work focuses on the nature of the humanitarian system and humanitarian action in difficult environments. She has a special interest in the inclusion of people with disabilities and older people in humanitarian assistance and protection, and she recently wrote the pilot minimum standards for age and disability inclusion, the ADCAP standards. And our second speaker is Ivan Kent. Ivan is the program manager of the ADCAP project, the Age and Disability Capacity Program. Ivan has 15 years experience in training, management and evaluation of livelihoods, advocacy and inclusion programming in fragile contexts in Africa, the Middle East and in South and Southeast Asia. Before joining HelpAge International, Ivan worked for a non-profit organisation tackling isolation and elder abuse in the UK. So, Ivan will speak first about how age and disability affects people in crisis situations, and he'll introduce the ADCAP project. Then Sarah will introduce the minimum standards for including age and disability in humanitarian action. And after they've spoken, we'll open the floor for questions and discussion. So over to you, Ivan.
Great, thank you, Frances. Okay, so welcome everyone to this first webinar on the minimum standards for age and disability inclusion in humanitarian action. So the purpose of this session today is really to introduce the minimum standards as a new tool for humanitarian programming. The minimum standards have been developed by a group of 7 agencies. You can see their logos down there. So these are a group of agencies who have come together to strengthen capacity of age and disability inclusion in mainstream organizations, and to really see how we can pull out some good practice around this challenge. We're funded by OFDA and DFID through the START project. Today we're just to say that the minimum standards, just to begin with, is covers a whole range of different sectors of humanitarian work. So there are guidelines for shelter, health, nutrition, food security, etc. But we won't be covering all of those today. In fact, there's a longer series of webinars that follow this one, where we're going to drill down into each of these different sectors to see what good practice in age and disability inclusion looks like. So today really is just to give an overview of what the standards are. But what we do recommend you to do is, if you take a look at the top of the slide here, there's a web address. I don't know if you can see that. That'll be repeated throughout all of the slides. Perhaps Tiffany at DR can type that into the chat window on the right. But that web address at the top, if you take some time at some point to type that into your browser and download a copy of the standards, then you'll be able to have a look at them and give us your feedback. That'd be really useful for us. So to begin today's session, and to get us into the context, what I wanted to do is really to start with a question, a bit of a polling question. And I want you to consider this as it's there in front of you. The question is this: so meeting the needs of older people and people with disabilities in humanitarian contexts is a responsibility of specialist agencies. So have a look at that and see how far you agree with it, whether you think it's true or false. What I mean by specialist agencies are ones like HelpAge, Handicap International, CBM, etc., focus specifically on older people and people with disabilities. So just have a look at that and we'll see what the votes come in. If you look on the panel to your right, there's a green tick if you agree and a red cross if you disagree. So just consider that statement and make a vote on it. Okay, great. So, yeah, the no's are coming in higher and higher. So, yeah, we can see here that, of course, you know, most people, we've got 20 people saying no, and very few saying yes, a couple saying yes. So most people agree that, of course, it's the responsibility of all of us within the humanitarian system to meet the needs of older people and people with disabilities. Of course, specialist advice is needed at some times, but the minimum standards really start from the premise that this type of action is the responsibility of the whole system. And the minimum standards are being currently piloted within 2 countries by some mainstream or generalist agencies. So we have a look at this slide here. In Kenya and Pakistan, we've got Islamic Relief and Concern Worldwide, together with HelpAge, currently trialing and piloting the minimum standards in Pakistan. And in Kenya, Kenya Red Cross and Christian Aid are doing the same with CBM in Kenya. So piloting the minimum standards currently within these 2 countries by mainstream agencies. So before we look at the standards themselves, what I wanted to do next really was just to remind us of the global picture of age and disability. So data on disability, as many of you will know, is poor. But WHO, the World Health Survey data, tells us that about 15% of people globally have a disability of some sort or another. And we also know that older people in particular are often unlikely to self-identify as disabled themselves, even though many will have impairments and will face barriers to participation in the same way. In fact, more than a third of people over 60 have some sort of impairment. So, considering those figures, we think that numbers of people with impairments are likely to grow, not least because of global population aging. So the figures on these slides, just have a look at them for a minute. They're a little out of date now, but about 12% of the global population are over 60. That's 1 in 8 at the moment. And by 2050, we reckon that number to rise up to about 1 in 5. So that means that it's good news. We're living longer, and there are more opportunities there, but it also means that we have to adapt our services, and that also includes the humanitarian services that we provide to others. And contrary to popular belief, aging is happening globally, albeit at different rates, but currently it's estimated about 2/3 of the population over 60 are located in so-called developing countries. Okay, now if we have a look at rates of impairment in humanitarian contexts, we can find that these can be even higher than we might expect. So have a look at this diagram, which is based on data from surveys in refugee camps in Jordan and Lebanon following the Syrian crisis. So in end of 2013, beginning 2014, and according to this data, of 3,000 refugees that were interviewed, 1 in 5 were found to have an impairment of some kind. And amongst older people, so that's people over 60 in this case, that was 70%. So 70% of older people had an impairment, whether it be physical or a sensory impairment, so to do with hearing, eyesight, these sort of things, or an intellectual impairment related to learning difficulties, dementia amongst some, or severe mental health issues. So all of these impairments really have implications for vulnerability on one hand, and also on barriers to accessing aid, which we'll have a look at in a minute. So we know instinctively that in a disaster, older people and people with disabilities are immediately at greater risk. And here are a few figures. In Japan, the Japan earthquake in 2011, over half of those who died, who were killed by the tsunami and the earthquake and the tsunami, were over the age of 65. But they made up only 1/4 of the population. And for people with disabilities, the mortality rate was twice that of the rest of the population. So we might think, okay, well, that's Japan with a particular aged population, but that pattern is repeated in other contexts as we start to get better data on what's happening in these events. So in Nepal, for example, recently, in the earthquake this year, the figures we have there are that 1/4 of the people who were killed by the event were older people, age 65 or over, despite them making up less than 1 in 10 of the population. So we know that these people are more at risk of fatality when a disaster, a rapid onset crisis hits. But of course, it's not just the immediate impact of the disaster that brings this additional vulnerability. So we know that older people and people with disabilities are often more dependent on health, transport infrastructure, and these can be particularly vulnerable to collapse or can be overburdened during the weeks and days that follow emergency and crisis situations. And these groups can experience, as a result, loss of essential medicines for some of their long-term needs. So consider things like heart disease or other issues. And they can also lose assistive devices, walking sticks, these kind of things. So these effects can lead to reduced functioning and greater dependence on carers. At the same time, we know that these sort of events can create great strain on social networks. And we found a large number of older people living alone, for example, in Ukraine recently. And there are also examples of people being stranded, say, when floods have struck, say, in 2010 in Pakistan. So that creates additional vulnerability for older people and people with disabilities. But there's another problem. And that one is something that we can do a lot about. A lot of humanitarian aid currently is inaccessible to older people and people with disabilities. That's first and foremost because a lot of them are just not counted during surveys. Older people and people with disabilities can be hidden from surveys, or data may not be well disaggregated, which means that they're just not visible and they're just not counted. And the next issue is that if they're not counted and then they're not interviewed and their needs are not known, then infrastructure and services may be poorly designed and inaccessible to them. So we're thinking here of, obvious sort of physical barriers to participation and access, such as long distances between water points, or rough steps, or difficult ground, or it could also be long queues for handing out of NFIs or food distributions. It could be inappropriate foodstuffs, or it may be just things like communication. So imagine people with hearing or with sight impairments or mobility impairments may find it difficult even to know about the delivery of humanitarian services. There's another issue in that their capacities and leadership roles of older people, people with disabilities, can be overlooked and ignored. Now, in some cases, when they've been sought out and recognized, we can find that they can play a very important role. Say in Jamaica, during hurricanes there, older people played a key role in early warning systems. And together they've provided support in taking lead in counseling during Typhoon Haiyan in the Philippines. There's a fourth issue here on the slide, which is just a reminder that exclusion from humanitarian support or inappropriate support for these groups can exacerbate or create additional risks for them. So if you consider, for example, the long distance that older woman or disabled woman might have to travel to reach a latrine or a water point, that can expose them to further abuse, risk of violence, abuse, indignity, etc. So things really to bear in mind. Okay. So now we've had a look at the context a bit. Let's have a look at how we might try to resolve some of these things. So I want you to to consider this scenario. Imagine there's been an earthquake and there's a health clinic here that's surviving. People in this health clinic, they're really concerned that they enable access for people with mobility problems to enter, so older people, etc. They want to make sure that they can access the clinic and its services. So they suggest that one thing that they could do is to build a ramp. So just have a think about that question there. Do you think that naturally would be the first thing to do, to build a ramp to help access to a clinic? Again, if you agree with that statement, put a tick, and if you think it might be questionable, put a cross, put a false. So I'll just give you a minute to consider that question. Okay, thanks. So we're just looking at the results here. Okay, so yeah, we've got 4 people who think yes, but the vast majority think no. And of course, the reason is that there could be many other issues to do with access. So for example, people may find it difficult to access the clinic because they have transport difficulties, in which case providing some kind of outreach service might be good. Or it could be that they find difficulty queuing for long times when the clinic is overburdened, in which case it could be good to set up a protected space or time slot for people with long-term issues to attend clinics. So yes, for sure, you know, a ramp could be one of the things to do, but I guess the message really, the first point is about consultation with older people and people with disabilities. So that's really what the minimum standards aim to do. They're supposed to guide the humanitarian practitioner through these kind of considerations, these questions. They're supposed to help the person go through the thinking as to what could be the right things to do, the right questions to ask, the people to consult, and the different kinds of options for adapting existing programs. So the standards are also useful as a tool for capacity building, for training, and also for supporting coordinated action in terms of increasing access to facilities and services by the humanitarian sector. So I'm going to now hand over to Sarah, who will tell us a little bit more about the content of the standards and how they were put together.
Thank you. I hope you can hear me okay. There were 3 main elements to the process of developing these standards. The first, a systematic review and mapping of relevant existing guidance and standards, and drawing on the Sphere Handbook, Sphere Companion standards, other mainstream standards, as well as the more specialized guidance material focused on age and disability. So a wide range of sources were mapped against key phases, key aspects of programming, and different sectors of programming. And the aim was to ensure that the standards are as comprehensive as possible, but also as usable as possible. So not designed as a technical manual, but with signposting to other guidance along the way. Key thing, to the extent that they're based on existing standards, and much of what's in the minimum standards is already contained in the Sphere Handbook and so on, is that these standards are not necessarily demanding anything entirely new of agencies, but really sort of bringing to the forefront what needs to be done for older people and people with disabilities to be effectively included in humanitarian programming. And to complement this mapping exercise, we conducted semi-structured interviews with a range of stakeholders representing different levels and sectors of programming, and those with specialist knowledge of age and disability inclusion, but also non-specialist practitioners and sector specialists who are able to advise on the relevance of different sort of levels of detail for practitioners on the ground. And as we went through successive drafts of the standards, we consulted with a range of, again, specialist and non-specialist agencies to ensure that we were including the right issues, the right actions, and ensuring that we were speaking directly to practitioners on the ground, and emphasizing the capacities of older people and people with disabilities, as well as the actions that need to be taken on their behalf. So if we move on to the next slide. The standards basically consist of 8 key inclusion standards, which are really designed as overarching standards to be achievable in all situations and sectors of response, and to be achievable really from the earliest stages of a crisis. And then to complement these key overarching standards, we have sets of sector-specific standards, which are more aimed at technical teams, clusters, sector specialists, in these particular areas of protection, WASH, food security and livelihoods, nutrition, shelter settlement and non-food items, health and education. Very important to emphasize that these sector-specific standards are not designed or intended to be used in isolation from the key inclusion standards. They very much go hand in hand together. And the intention is that the inclusion standards that span across all areas of programming shouldn't be lost sight of when practitioners are looking at the more sort of technical details of, say, WASH programming or nutrition assistance. And throughout all of these overarching standards and sector-specific standards are some very important cross-cutting themes. So protection isn't only treated as a specific sort of set of standards for that area of programming, but also as a key consideration throughout all the other areas and different sectors for the standards. Gender is a really crucial cross-cutting theme, and was actually included as a key part of the initial mapping exercise that led into the drafting of the standards. So very much taking into account how disability and older age can affect women, girls, men, boys differently, and therefore might have different implications for programming. And also very important to mention is the crucial role of carers, which is easily overlooked. And of course, not only are many people with disabilities and older people, not only is their access and inclusion often affected by or very much dependent on their carers in many situations, but also carers themselves may face a variety of access and inclusion barriers because of their role as carers. So that's something that we've tried to keep sight of and incorporate throughout the standards. All of the standards are accompanied by actions that are designed to support their implementation in practice. And then the sector-specific standards, in addition to that, also include signposting to further resources to support practical implementation, which would obviously contain a lot more detail than is contained in the standards themselves, and case study examples to really to illustrate the extent to which the standards are and should be achievable. So to move on to the overarching, the key inclusion standards, these are based on the first 8 of the 9 commitments of the core humanitarian standard on quality and accountability, the CHS. The intention of making a link between these minimum standards and the CHS is really to, well, for a start, to maximize the complementarity and the coherence between these and other mainstream standards in the humanitarian sector, and thereby avoid unnecessary proliferation, if you like, of standards. But also, very importantly, to underline what accepted mainstream standards actually mean for these groups. You know, how for humanitarian standards more generally to be meaningful in terms of the inclusion and access of older people and people with disabilities, what does that mean in practice, and what standards apply to make those general standards meaningful for these particular groups. So that very much reflects the fact that, I think as Ivan mentioned earlier, the principle of humanitarian impartiality that really underpins mainstream standards across the board, in practice depends on very active inclusion of older people and people with disabilities, as well as other groups that are at risk of exclusion. So if I move to the key actions as an example, because there's no need to go through them all here, so I've just picked out one example from the Key Inclusion Standards, Key Inclusion Standard 4, and I apologise for the typo on this slide at the top, which should read people with disabilities and older people. One of the key actions, there are several, but one of the key actions for this standard is to ensure that people with disabilities and older people and their carers participate directly in needs assessment, consultation and feedback mechanisms to inform programming. And then some examples are given of what that should include, and the example here to consult people with disabilities and older people about their communication needs or preferences. Throughout the standards, there's the continual reference to consultation, because even with something as simple as communicating information, people, older people and people with disabilities will have a variety of needs and barriers that they face in accessing information, and always important to actually ask them and consult with them about what it is that will enable them to access information as well as other people in the affected population. Sometimes that may be as simple as providing information in pictures as well as in the written form, or people may need to receive information verbally rather than just written down. So depending on the context, it's often quite straightforward measures that can be taken, but it's actually asking that question in the first place, which is absolutely crucial. So moving to the sector-specific standards, I've just picked out the example of the WASH standards, water, sanitation and hygiene. And the standards in these sector-specific standards really focus on the participation in needs assessments of these groups, their inclusion in the design, implementation, monitoring and evaluation of services and facilities. They're, again, coming back to the information theme, their accessibility to information about these services and facilities, and, of course, the accessibility of the services themselves, ensuring that those services are appropriate to their access needs and sometimes to their additional needs, so that obviously in this sector applies to water supply, latrine facilities, hygiene services and facilities. So going into a little bit more detail on just one of those standards, I've picked out WASH standard number 4. Again, each of these sector-specific standards has a series of actions, and I've pulled this one out here, WASH standard action 4.1, which recommends the design, build or adaptation of a minimum of 15% of latrine facilities, including separate facilities for women and men that are accessible to people who have physical or visual mobility limitations, so that they can use them easily and, crucially, with dignity. And so, well, what does that mean in practice? Again, as I mentioned earlier, these standards are not intended as a technical manual with lots and lots of detail about what that means in practice, because actually there is a lot of that practical guidance out there already, and so we have included some signposting to some key documents that can help in that regard, although we do include some examples to to provide an initial guide to what that might mean. So just one of the resources that we signpost people to is the Compendium of Accessible WASH Technologies, prepared by Hazel Jones and Jane Wilbur, published in 2014. And so there are some images here pulled out from that compendium that really show the extent to which the adaptations and sort of universal design principles and accessibility principles that these minimum standards emphasize are often achieved through really very simple and straightforward measures. So here we have the example of a guide string that would assist people with visual impairment to reach WASH facilities. Here, some support rails. And you notice in brackets, depending on users' needs, again, returning to the importance of consultation to actually find out what it is that will make a difference to people to actually access the facilities. But I think that this last image really drives home the extent to which really very, very simple measures here, just providing something for people to sit on. Something as simple as that can make all the difference between facilities being accessible or not to for many older people and people with disabilities. So I think here we have just to, so that you can see the way in which other more technical resources are signposted, and we have an example here of one of the case studies to illustrate the approach taken by particular agencies to that particular aspect of programming. I think at this point I will hand over back to Ivan.
Okay, thank you very much, Sarah. Okay, so we've seen, I think, that the minimum standards, you know, they do contain guidelines on each of the sort of main sectors of humanitarian action, and we'll be covering those in depth in future webinars. But there's the idea is that they are structured around a framework that will be familiar to a lot of humanitarian actors, so around the CHS and sphere as well. So really sort of thinking about what do these mean for older people and people with disabilities in humanitarian contexts. There's a lot of examples within the standards themselves at the end of each technical chapter, and then signposting to key resources as well. So just to go back to that slide before that we didn't cover in depth, if we have a look here, so for example at the end of the WASH section that Sarah's been talking about, here is an example of some good practice in Central African Republic, and there are a number of references to you know, specific technical information around how to support inclusion for those particular actions. Okay, so the idea is that these standards they build on a lot, them pull together a lot of the existing technical literature around inclusion, and they set a framework for really thinking about how best to incorporate this into humanitarian action, and with the premise sort of at the beginning that, you know, in most cases, you know, some simple adaptations of existing services and structures can make a lot of difference, and really emphasizing things like communication, participation, this kind of thing. So they're primarily, as I mentioned at the beginning, for practitioners' guidelines to help think about program design, but they also can be used as a kind of checklist for appraising proposals, you know, looking for evidence of inclusion within proposals. So they can be useful for not just people who are implementing on the ground, but also, people who are looking at proposals as well, and also people who are setting guidelines and technical support for their own organisations, albeit on WASH or food security, etc. So there's a lot of technical resources there to look at. And the other sort of purpose for them is really to use as a set of benchmarks or approaches that can be used for coordination of action in particular contexts, and also for training as well. So there's a lot really that can be done in terms of supporting humanitarian staff in the emergency preparedness phase, thinking about, how well are people aware of particular needs of older people and people with disabilities, and how they might need to, seek out their specific capacities and needs during surveys, how to use disaggregated data, this kind of thing. All of those actions really need to be built in at the emergency preparedness phase. Okay, so that's all for this sort of first overview of the standards. As I mentioned before, they can be downloaded through this web address here. So I suggest you do that and have a look at them. They are available in several versions at the moment. We have a clear text version, also easy to read in black and white, and also in blue and yellow to aid accessibility. We're just producing now a version in French and also in Arabic that will be out very shortly. They are a pilot version. We'll just come up to that in a minute, but before we get to that, we are really happy to take any questions that you may have. So if you'd like to type in any questions that you have into the box on the side, or raise any questions, we'll be really glad to see if we can respond to them.
Okay, thanks very much, Ivan, and thank you, Sarah. It's Frances here again. So as Ivan said, if you do have any questions, just type them in the chat box on the right-hand side of the screen. We've had one from Elizabeth Amina asking about the data that Ivan was referring to in his presentation, and perhaps also Ivan could address this, and also the more general question about data on age and disability in humanitarian context and the challenge that this presents.
Okay, thank you. Okay, so Elizabetta, I'm not sure which slide you were referring to when that question popped up. I'm sorry I wasn't following it, but we know that data is not, is really of variable quality, and that's one of the kind of, main points of the standards. It's reiterated throughout that we need to get better on that. Certainly in the cases of Japan and Nepal that I mentioned, that data was collected by governments, and data was quite well available at that point. But a lot of other contexts, it's very much less available. I think to a large extent we're not using data that is already in existence, and that can be used just to check. So, for example, what the proportion of older people and people with disabilities are that are using our services. That existing background data from WHS surveys, for example, can be used as a check to see how well services are currently being accessed. So yes, it's very variable. A lot of work still to do on data collection and using data. There is some work taking place at the moment. DFID have launched a new initiative to look at how disability disaggregated data can be collected within the context of humanitarian work. The standards themselves refer to a set of different tools that can be used, and most commonly sort of seen ones, of course, are the Washington questions, but there are a couple of others that are mentioned within the standards. There's a separate annex on that.
Okay, thanks very much, Ivan. A question about whether there are any plans or an intention to ultimately merge the ADCAP standards into the SPHERE standards.
Okay, so that's a good question. So the standards, minimum standards for age, disability, inclusion are fairly new. So we put out the pilot version in July. and very much when we were constructing it, we were referring to SPHERE and also the new core humanitarian standard as a guide, a framework really to help us put them together. SPHERE already, I think Francis mentioned right at the beginning that SPHERE in their 2011 edition started to look at what they were calling cross-cutting issues, of which age and disability were one. Part of the reason we put the standards together was that we felt that agencies were still lacking more specific guidelines and resources on really what those recommendations in SPHERE meant, how to put them into practice. But we are currently having conversations with SPHERE to see how we can join as a companion standard. But we have still some more piloting to do with the minimum standards as they stand at the moment to move forward to the next iteration.
Okay, thanks, Ivan. And we've had a question from Hayward. Are there any plans for agencies to sign up to the standards like we are for the core humanitarian standard, or for potential certification in the future?
That's another really good question. So thanks very much for that. So currently we don't have currently the standards as they are presented really as a set of guidelines and benchmarks to follow. So we don't have any current firm plans for certification. We're really looking for feedback at this stage on how well they can be implemented in the field, but it's certainly something to look at in the future. My own sense at the moment is that it would be good to combine that with existing standards, the other question presented.
Okay, thanks, Ivan. A question which I'd like to ask Sarah to answer, which is about whether there's any guidance that's specific to particular types of impairment in the minimum standards.
There are some standards which, I would say no, that the standards themselves are relevant to all older people and people with disabilities. Obviously, in particular contexts and particular areas of programming, there will be particular groups of impairments that will affect people perhaps more than others. So, for example, in education, children with a sensory impairment may be particularly affected in the classroom. And so I expect, particularly in the application of the sector-specific standards, that practitioners will find that there are particular standards or particular actions connected with standards that would be very particularly important for a certain group, perhaps more than others. I think that it's much more in the application, the actions to apply the standards, that you might find those differences in application to different groups. Certainly the key inclusion standards and at the sort of top level sector-specific standards really speak to all groups across both older people and people with disabilities, because I think, the key thing is that it's really encouraging, asking for a way of programming, and in fact even within a particular group of people with a particular type of impairment, there's likely to be huge variation in the particular individual ways that they experience barriers to access, and of course that will also vary from one context to another, and perhaps from one phase of a crisis to another. So really one of the challenges of the standards, I suppose, is ensuring that they speak in a general way to actually what is actually quite a variety of different challenges faced by individual people, by different groups, and by practitioners in different contexts. And so I think it's actually using the standards to work in a particular way, and going back to what we were emphasizing earlier, the importance of consultation. Usually the experts in you know, the most effective inclusion of the people themselves that these minimum standards are seeking to include.
Okay, that's great. Thank you, Sarah. And I think we've got time for one last question that we can squeeze in, which is a question we've received about why we're focusing particularly on older people and people with disabilities. What about other vulnerable groups that are frequently excluded in humanitarian action? Sarah, do you want to answer that one, or?
Yes, and well, Ivan may want to add to it, but I'll certainly make a start. And obviously, that's a question that has come up before, and really these standards are within very much within a sort of broader perspective of encouraging and demanding a more people-centered, integrated people-centered approach, very much emphasizing inclusion, participation, removing barriers, and making activities and services accessible. And if that's done well, then it's actually the same kind of practice that would ensure inclusion of other groups and not just older people and people with disabilities. So as a way of working, we wouldn't say that the approaches and the standards included here in any way kind of single out older people and people with disabilities in a way that wouldn't actually help a broader range of people who are at risk of exclusion. On the other hand, these are two large groups, and two very large groups which are consistently overlooked in humanitarian programming. And there are some specific adaptations that can be made that are common to these two groups, which don't necessarily cost a great deal or take a huge amount of effort always, as we've been discussing, to make a big difference. And so I think that it would be encouraging a more general people-centered integrated approach to be applying these standards as consistently as possible, and also making sure that these particular groups are not overlooked in the way that they have been in the past. I don't know if Ivan wants to add anything to that.
No, I think that's great, Sarah. Thank you.
No, thanks very much, Sarah. That was very clear. So we're almost running out of time. It's just time for me to go back to Ivan, who's going to give you some information about upcoming webinars and e-learning opportunities.
Great, thank you, Francis. So this is an overview of the standards. I hope you've got a first flavour of what they contain. I'll type up in the chat panel in a moment the address where you can download them and access them and have a look at them for yourself. Just a reminder that there are some webinars coming up over the next sort of 18 months, so on different humanitarian sectors. So if you have a look on the slide on the left-hand side, we'll be looking at some of these areas: emergency education, shelter, protection, WASH, really unpacking what these mean, what age and disability inclusion means in these different sectors, and some tips on how to do it. We've got a range of sector specialists to present on those things. I believe we're starting the next one on the 26th of January, I think, with one on data collection and needs assessments, which is a really hot topic at the moment in terms of working out data disaggregation issues. So all of these are available through the same place, through the Disaster Ready portal. A reminder also that the ADCAP program is also developing a set of e-learning modules. We've got two of those in place at the moment, one which gives an overview of disability inclusion and humanitarian response, and another one on understanding older people and their needs in humanitarian context. Those two are available now at the same place. If you go to the Disaster Ready site, they'll be followed up by some others next year. We're planning one on communication, and also looking at one on carers, who are a much neglected group in humanitarian intervention. So all of these things coming up in the next year. Okay, so one final point from me really is to thank you for attending, but also to draw your attention to the fact that the minimum standards are a pilot at the moment. We're testing them, as I mentioned, in Kenya and Pakistan currently. We really need your feedback. It will help us a lot with the next iteration of the standards. And this is the email address to use. So please do get in contact via that email address if you have any feedback at all on the standards themselves or are interested in testing them, gaps, issues and things like that that we've missed. Please do let us know. That would be really useful. Thank you very much.
Great, thank you, Ivan, and thank you, Sarah, as well, and thank you very much to everybody who's joined this webinar. As Ivan said, do please get in touch. We'd love to hear your feedback and your thoughts or suggestions for the development of the inclusion standards for age and disability. We've just hit the top of the hour again, and so we're on time, and we look forward to having you join us in future webinars that Ivan mentioned and that you can find more information about on the Disaster Ready website. So again, thank you very much, and goodbye.
Thank you to Francis Stevenson, Ivan Kent, and Sarah Collinson for an engaging and informative presentation today. If you have any questions, please do reach out to the ADCAP team or to us at disasterready.org. Thanks so much.